Hi everyone, this is Dr. K. Welcome to my video series. Today I want to talk about the benefits of using stem cells versus traditional treatment. Most commonly these days stem cells are being used for arthritis, so I'll briefly discuss that as one potential treatment option. The most common treatment for osteoarthritis or like some people call it bone on bone or severe joint pain is to get steroid injection or sometimes hyaluronic acid injection through the orthopedic doctor's office. But those treatments are usually not long lasting, they're not permanent treatments, they're temporary. Lately there is some research that the steroid injections can cause destruction of the surrounding bone area. So it can theoretically accelerate the joint disease or the arthritis in general, although the client experiences pain relief for a few weeks to a few months. So the other treatment is when the disease is end stage, when none of the treatments are working. Most of the times they go through what's known as joint replacement. So the orthopedic doctor will take out the present joint and put artificial prosthesis in place of that. So it's done for knees and hips. Sometimes they also do reverse shoulder surgery for arthritis. So most of the times these surgeries lead to a long post-operative recovery. They also may require general anesthesia, and when we use general anesthesia there's a risk of complications from that. And just like any other surgery, there are risk of complications like blood clots and so forth from the surgery itself. So if you choose to go the route of stem cell therapy, potentially you can use umbilical stem cells from the umbilical cord, like mesenchymal stem cells. It's a simpler procedure, it's lower in cost. There is no general anesthesia, there's actually no surgery, it's minimally invasive. It's like getting an injection into the joint, and obviously there is minimal recovery. The client can start doing the regular activities right away, and there is low risk of rejection. So unlike transplants, there is minimal or no risk of rejections with these types of stem cell treatments. And there's also low risk for disease transmission. These stem cells are FDA regulated, and these are tested at multiple sources to make sure that there is no infection transmission from the donor to the recipient. So with all these advantages, it makes more sense for our clients to get stem cell treatment rather than going through joint replacement or other high-risk procedures. Over the long run, they also save money. A lot of people believe that once they get joint replacement, they are permanently fine. But after 10-15 years, those artificial prosthetic joints can fail, and that can lead to repeat surgery. So that's more risk later in life. So most of the times we see multiple surgeries, especially when you start young with degenerative arthritis. So we avoid all of that with stem cell treatments. So these are some of the benefits. I gave you one scenario with osteoarthritis. There are multiple other scenarios, and we can discuss that in future videos. Thanks for listening to me. Thanks for this opportunity.